Now, reacting to this from the European Union, there is word that it is still testing the Pfizer vaccine, and it insists that the forecast of having a vaccine, a viable vaccine, by 2021 is more realistic. Let's bring in for some analysis on this situation Pauline Londeix, who's the co-founder of OTMEDS Observatoire. Pauline, thank you very much for joining us. What is your reaction to this news that Pfizer says it has a vaccine that is 90% efficient against COVID-19?
Good evening. So, of course, we want to see, everybody wants to see a vaccine and to see vaccines put on the market as soon as possible to face this pandemic. But unfortunately, so far we can only rely on the information that were released by the drug company Pfizer, which said that the vaccine is 90% efficiency. But unfortunately, so far we don't have enough information on what this 90% efficiency really means. And also, it was not reviewed yet by independent review committee. It was not reviewed yet by the US Food and Drug Administration. So we need data. We really need accurate science data to be able to celebrate any victory for the vaccines, in the race to the vaccines. And we have seen in the past months the race and the geopolitical things that were at stake, and financial things at stake as well, that could lead maybe to some disappointment at the end. And we really need hope, but we don't need false hope. We need to have concrete, accurate information, and that's why we really need transparency around the protocol of the vaccine that Pfizer has developed, and also transparency on the other vaccines being developed by other developers.
Pauline, you came into our studio. You told me at that point, wearing your mask here in the studio, that the important thing was to have the right kind of data, to go through the right kind of tests, and to not do things too quickly. Is that what you fear, that Pfizer and others trying to find a solution quickly may go too fast?
I don't think anybody is going too fast. We need to go fast in order to fight properly against this pandemic. But we do need to do it properly and with methodology. And we need cooperation, coordination between the states, between the governments, between the developers, to have complementary tools being developed, not the same tools being developed in parallel by different developers. We need to have different vaccines that respond to different needs of the population. For instance, vaccines that would answer the issue of the transmission of the disease, that would prevent it, and also other vaccines that would maybe more reduce the severe form of the disease. So we need different tools to fight this pandemic. And unfortunately now, what we see is that we have different developers running in their site and trying to put as fast as possible one product on the market. And unfortunately, we can't only rely on the communication of the pharmaceutical company Pfizer. We want to have good news. We want to have vaccines that work, but we need more information, and we need scientists, we need expert committees to review this information and data.
Pauline, you're talking about cooperation, coordination. I mean, clearly the drug companies have a kind of a double aim. They want to obviously get the vaccine out there so they can save the world, but also they want to make money out of it too, and one can understand that is business. But what you're talking about is purely and simply saving people and getting the right thing done. And you say coordination is needed. Who should be responsible for that coordination? Who, on a world level, do you think?
Well, I think what's something very important to remember is that Pfizer received public money to develop this vaccine. The German biotech received public money as well, millions of euros in Germany and also at the European level. In France, the government gave money to Sanofi and others to develop vaccine. So there's been a lot of public investment on these vaccines. Therefore, the governments have the legitimacy, and also they should take the lead in coordinating this response. I don't know if but it has clearly there is a lack of cooperation and coordination between the states and the developers that are once again funded by a lot of public money.
So it's urgent to get this coordination done. Pauline Londeix from the OTMEDS Observatory, thank you very much indeed for joining us. The news then on the situation regarding the new vaccine, greeted with a little coolness there by Pauline Londeix, pointing to the fact that there should be greater coordination, greater testing, but nonetheless the urgency should be there to find that vaccine to try to go back to the words of President-elect in the US, Joe Biden, turn this pandemic around.